Welcome everyone to today's webinar. It's about communication, how one health system leveraged mobile technology to improve patient safety and quality of care. I'm Mackenzie Bean with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters, Forrest, Winslow, and Rea Berg. Forrest started his career in EMS in Chesapeake, Virginia back in 1985 at the age of 16. After completing his education at Virginia Tech, Forrest decided to stick with EMS. He is now newly retired from the Chesapeake Fire Department, but not from the memories he's built serving in EMS for the past 34 years, and from his other clinical experiences as an RN in the cath lab and emergency department for 20 years. Forrest also served as the improvement officer for the fire department, where he discovered his love of data and performance improvement. Today, Forrest serves as a clinical specialist at Pulsera. Rea Berg has worked as a registered nurse for over 20 years in both clinical and leadership roles. She has worked at Stamford and Greenwich Hospital in the East Coast in various roles, including critical care registered nurse, nursing supervisor, manager of nursing resource, and critical care unit. Rea has been at Virginia Mason Medical Center since 2012. She started there leading nursing supervisors, resource nurses, and managing the transfer center. Currently, she is the director of the emergency department and observation unit at Virginia Mason. At this time, I am pleased to turn the floor over to Forrest to begin today's presentation.
All right, thank you everyone for joining us. Before we jump into having a conversation with Rea about her experience at Virginia Mason with the Pulsera platform, I kind of like to give you an outline of what we're going to cover today. We're going to start off with how her experience with and her team's experience with Pulsera has gone over since they went live with the system as far as a communication tool. We're also going to try to talk a little bit about regional expansion that's happening out in the Seattle area where Virginia Mason is located. And at the middle of the presentation, we're going to really drill down onto some quality measures and data that is obtained from the Pulsera system. And then the nice other feature, which is team feedback and then transfer of patients between spoke and hub facilities. So with that being said, I'm going to jump in and try to give you an overview of what the system is about before we start having some questions. So when we traditionally in healthcare, we've had silos of communication that occurs. We do really well with inside of each team where we have our communication structure, but when we try to cross those disciplines or actually go between different facilities, we start to see a breakdown or a dilution in the quality of the information because we're basically passing it from one person to the other. One of the things that our healthcare has tried to do is we've tried to bridge those gaps between the different silos, and some of the technologies are very good in the sense that they answer from one, say, EMS to an emergency department communication, but they use multiple systems typically, and but that doesn't go from the beginning of the process towards all the way to the end of the process. So one of our solution is we're trying to fix that communication that quite often leads to poor patient outcomes and also not meeting clinical benchmarks within our realm of practice. How technology is different today, even though we have failed to embrace it, smartphone applications are a part of our daily life, all the way from when you are doing your daily functions, you quite often probably refer to apps on your phone versus going to a computer today. Our technology is much like that. A lot of times most of us are ordering packages through web services such as Amazon. We're using ride-sharing services. And then most recently, one of my business travels, I basically did all of my planning through a smartphone application, all the way to checking into the hotel and unlocking my door with that technology. So more and more every day, we're seeing our communications being handled and our lives being handled by mobile technologies. But when we get back into the healthcare world, a lot of times there's a breakdown in this ability, mainly because everyone's concerned about HIPAA. Pulsera is a HIPAA-compliant platform that allows you to facilitate communication between all of these disciplines, from pre-hospital all the way up to your interventional teams. And especially when you're dealing with transfer cases, this becomes very problematic. And so we have bridged or created a solution to allow for that. What that looks like most of the time is that we have this clear red line from the beginning of the process all the way to the end, where we open up a patient channel for communication around that one event. So I'm going to let Rea jump in here, and we're going to start going through some questions that we've discussed. Rea, tell us in the Seattle area at Virginia Mason how Pulsera has streamlined some of your communications.
So we, I guess it's afternoon, but so I'm really pleased to share some of this exciting information, because here at Virginia Mason, the teams were really ready for this technology to improve patient outcome. And the way we set up the patients and the teams were really around using our Virginia Mason production system methodology, where we brought our team together and patient family that we get feedback from to ensure we were bringing in the accurate and a technology that would truly improve our patient outcomes. And what we found was that this technology truly impacted and gave the teams and patient positive outcomes. We started with the stroke team, and the thing that happened was, without a technology like Pulsera, with this communication tool, we went from really having a process where it goes in a linear way, one to the next. And it moved us to a parallel process where things were happening at the same time, which improved the efficiency. The other thing was it truly allowed individualization of alerts, where we were able to truly look at that patient in real time, and with messaging able to communicate and provide that patient the individualized care. So it created a true team culture, because everyone really saw what they were working, and like Forrest mentioned, remove the silos. And then at the end, we saw the impact it had on our cases for door-to-needle by decreasing that time and activation. So we really had positive outcomes with bringing in a technology like Pulsera.
Awesome. So, Rea, now in Seattle, you were the first to go live on Pulsera. Is that correct?
Correct. And we were the first, and most of the EMS agencies around did not have Pulsera. But I must say that, like, looking back and doing self-reflection, it was the right thing to do, because what we did was sort of reverse, because we even had state and regulatory visits here at Virginia Mason, and they had mentioned seeing this technology somewhere else, but they focused on the EMS portion. But what Virginia Mason stood out with was, we really worked this communication tool internally. So we were able to bring our teams up to par with using this technology for communicating amongst ourselves. So we have EMS now going live in the region, but we are ready internally, and the teams here are very used to the technology and very fluid in using it.
Yeah, a lot of times when people first approach us or hear about us as a company, they think that we are an EMS to hospital communication tool. But as you both you and I know, the magic of the system really is the internal communication that it creates within the walls of the hospital itself. One of the things that we do know that when you have all team players or all disciplines involved, the system's much more efficient. But in the beginning, you were doing this without EMS involvement. Is that correct?
Correct. So
Yeah.
when we did our improvement work, we collaborated with EMS agencies and got input, but we truly did our process work internally.
Awesome. So now, as far as the regionalization and trying to establish a regional system of care, kind of give me an idea of what that's going to look like for your area.
So that's a really good question, because what we have commitment, and I know Pulsera have contracts with our regional hospitals around. So in the Seattle area, all our hospitals are going to be on board, and their time frames, like we already have our Medic One, who have gone live who will go live as of January 2020, and we have AMR, which is another EMS agency. So we're looking at by the beginning of 2020, all these facilities and hospitals, not only in our Seattle area, but even on the outskirts, going to be implementing Pulsera.
That's awesome. That's a good approach there. So now, earlier you said that you had decreased your door to groin puncture times, and a lot of your metrics had gotten a lot better. I know that we've talked about a few case studies that you want to present to us or talk to us about. And this one that I just threw up on the screen, when you look at it at face value, the times don't look that great, but when you drill down onto one of the things in there is that you actually had a Pulsera activation to actually groin puncture of 13 minutes. You want to tell them a little bit about that case and how this came to be?
Yeah, so that was a case that came in from Medic One, and it was an emergent IR activation. I do want to say that as soon as we receive indication, and Medic One is not using the technology, but the key about this is once we got the call and we knew the patient is coming in and able to triage with their LAM score, we are able to activate Pulsera to the entire team internally. And when that patient hits the door, that's where you saw that 13 minutes from activation to groin puncture, because we had our IR team here. We had everything set up, and the team was actually waiting at the entrance in the ER to get that patient moving right through the system. And that's where we hit that 13 minutes to get that patient care. So it was remarkable.
So talk a little bit about how Pulsera kind of allows you to drill down and make those communications streamlined to the point where you can meet these numbers here, these 13-minute numbers.
So what Pulsera, so some of the things that is really great in Pulsera is the way it's set up and how we made the process. Every team member involved in the case, from neurohospitalist to the charge nurse, to CT, to radiology, they all have very clear standard work and roles and responsibility. So so they know which part in the app they are controlling. And the thing is, the whole patient's flow is visible to the entire team. And that's, I think, the true beauty about this. So, for instance, the patient comes in, I'm the neurohospitalist, I have a question about something, I message the question, everyone sees what's happening. So it's the clear communication that really makes this process work and create that efficiency.
Right. So tell me about you had a couple more cases you wanted to talk about. I believe one of them was a thrombectomy case as well, where your times were exceptional. You want to walk people through that case?
Yeah, so this case was a case we got because we get a lot of patients from regional areas where they don't have access to a lot of the care. And this was one of those emergent cases coming from a regional area. And when we were notified of this, we activated Pulsera for this stroke patient at 11:08. And this patient's groin puncture was at 13:49, which is 14 minutes from the time the patient arrived here in our ED to the time they were able to do the groin puncture. And this was amazing because our goal when we looked at our processes, our goal was for these transfer patients to be less than 45 minutes for door to groin puncture. And seeing that we can make a mark at 14 minutes was just tremendous. So I think the key here is activating that Pulsera, the first activation, because that's where everyone is, notified and know exactly what their role is in responding.
Right. So who is on the initial alert? Let's take a stroke, for example, where it's not necessarily a thrombectomy. Who gets that initial alert once your charge nurse enters the case or EMS enters the case? Where does that go for you?
So we have two trajectories. So for the transfer patients, the teams involved, we definitely have the patient transfer center because they have the look of the entire org, and they're like that successive check, and they're involved in bringing in patients. That's our portal of entry. We have the EDRN, the charge RN, who really is the one who makes that first activation. And then we also, with these transfer cases, we have our CCU resource nurse who is involved in all our cases, our neurohospitalist, we have our IR, RN, MA, and techs, our IR, MD, and we even included our anesthesia. So because these transfer cases, we know that most of the time they're going to be an IR case, so we are able to, and just to be clear, as we brought in Pulsera, we also had learnings where we updated things. So one of the features we recently added was once we know a patient's LAM score is 4, we're able to toggle on the IR team, and they are notified immediately. So that eliminates the need for waiting and wasting the time to then contact them. So that was a feature we learned that really pulled this through.
Yeah. So on the app, I know that we have talked about the time clocks before and some of the visual cues. Earlier you said that in your system you had goals. Now, the slide I have up right now is showing some of those colorized bars and also the time clocks there. Give me some real life examples of where you think that might have changed or how you're using that those tools within the app.
So the way the tools work is you see the color codes. As it's green, we know we're literally on target and we're making our mark with efficiency and getting that patient treated. When it starts going into yellow, we are approaching now closer to where we might surpass our goal. Red is we have passed our goal metric. So that's a good cue where we then start basically having dialogue and messaging on making sure the team understand what's going on. And the beauty about this is sometimes there might be something. So, for instance, this slide you're showing with the CT, there might be a case where, oh dear, we have an emergent case and we might need to, that's on the table, and we might need to use our escalation plan and get our patient to the next CT area. So those are sometimes things that happen, or there might be a case that, what would we say? We call it wishy-washy, but we're not very clear on what's going on. So those are some of the things that these different goals and color cues the team in to really understanding what's happening.
Awesome. And then the time clocks, I know they're a little different for like the STEMI module. For them, instead of having last known well, you have first medical contact, which is always good because that's just the way those things are measured. Tell me about which modules you're using at your facility right now and what your plan is as far as expansion with the modules.
Yeah, so we had a very nice, clear plan on how we're going to bring in this app. So we first started with our stroke patients, like you saw. Then we did our, that included our internal stroke as well and our transfer patients. Then we moved to STEMI, and we just implemented STEMI, and it's going really well. STEMI is a lot less involvement with such a huge multidisciplinary team like stroke. So STEMI was a lot smoother and easier transition and implementation. So the next step is we're looking at neurosurgery because we're taking it a step further now. So that's in our plan to look at neurosurgery. And then we want to look at, we're having dialogue now actually with our OR teams on how we can utilize this app in the OR area. And so it's expanding, and it's just the beginning of what we can do with this technology to help us in everything. We're also looking at sepsis and even how we can use it with code gray in the ED. That's our safety code. So we are learning every day and adding on things, which is amazing. And then really looking forward to when our EMS goes live in 2020 early to even see further the impact it has on our metrics and our patient outcomes.
Yeah, and so I guess to be clear, when you guys went live with the system, at that point we only had STEMI stroke in general as far as the modules. We added those other ones back in November of last year. So under that, you talked about unique teams and code gray. Those all are things that we house under the general module typically, and they're all based on teams. So like you were saying, the system can be expanded, and it's up to your imagination, how many teams you can build within the system as far as activating folks. One of the some of the data you sent me was pretty interesting as far as looking at your median door to CT times, and so you want to speak to that a little bit, Rea, as far as how you utilize this and who do you give the information to and.
Yeah, so we have I'm very proud of the robust and engaged stroke team. So we have an entire department with a stroke coordinator, a data person for our stroke, and we have an administrative director and a medical director of the stroke program. So what we do is bi-weekly we meet, and this team that who are the key stakeholders, we review each and every stroke case that comes into our organization. And when we review them, we review the details from the time we get the call. And this is our process improvement, where we look at trends and where we look at where we need to improve and get it back to our frontline teams and be able to see what's also happening. In addition to this, we have a Pulsera guiding team where we meet so that we can review how we're doing and where we're heading. So we really have a clear process. And I do want to say that regionally, as the teams come in with Pulsera and implement this, we are all as a region going to also be meeting and discussing how we are utilizing Pulsera and ways for process improvement. So the key in really getting teams' input and having recognition for who is doing well is by reviewing the cases, getting it back to the frontline team. I mean, we do really need things like in the ED team or anyone within the team that did a great job. We are able to provide recognition and celebrate. So it really keeps the momentum and the teams engaged to want to do even better. So it's a great way in which we do our process improvement.
That's awesome. So you had sent me another thing that we created a graph for around, how you've looked at some of your clinical benchmarks and some improvement that you've actually noticed in your system, especially around the groin puncture times. You want to talk to that a little bit?
Yeah, so it was really interesting because in September, so we went live with using Pulsera internally for the stroke patients around August 2018. So when we looked at September 2018, we had door-to groin puncture of like 150 minutes. And here we are in August 2019, where when we implemented Pulsera, have door-to groin puncture of like incredible, average 89 minutes. That's like a 40% improvement. And I just want to, it was just remarkable to see the difference and where we have come to with creating this efficiency in communication.
Right. And do you think that improvement, or what do you think the biggest contributing factor was to that improvement?
I think the biggest factor was really going from a linear process to a very parallel process and everyone seeing what's happening simultaneously and being ready.
Right. I think that's a good point. A lot of people, when you do communication tools, a lot of times, or when we look at different platforms, different providers have different views. And the nice thing about the Pulsera platform, no matter if you're an interventional cardiologist or if you're an EMS provider out in the field, those views of the system look exactly the same, and everybody has transparent communication around that. So the other thing that we, you've already mentioned this as far as messaging, the text messaging component, where we actually have some pre-scripted or either free texting messages. Tell me a little bit about that, because I know when we did our planning call, you referred to the messaging as really cool. And so I would want you to kind of, share with people how you utilize that and why do you think it's really cool.
So those words were from the team, because I still remember the first day we went live with using it. I wish I had a video camera, because the team, from the radiologists, because I was running around trying to see in each area, how the team was doing as the patient progressed through. And the team, it was like looking at kids with a new candy. It was incredible to see how, and those were their words, this is so cool, because they were able to ask a question and immediately get a response. And also, they saw the beauty of, they really broke down silos and understood each other's work. Because even initially, we had the pharmacy team, because the pharmacist would respond to all code strokes. And just so you know, initially we thought, okay, so the pharmacist does not have to leave their work. They can be notified wherever they are when they're really needed if it's a TPA case. As we move forward, we later learned that it was important to have the pharmacist because we actually save time. They do all our TPAs, so it was, those were some of the learnings we had. So I think the cool thing about the feature of the messaging, also really seeing this patient flow through, like I mentioned, was what the teams saw as being cool. And it, regardless of where you were, really seeing how technology is needed to help us move forward with providing the best care for our patients.
Right. So a lot of our customers end up having pre-scripted messaging in there for the frequently used items, as far as what you would say. In your system, do you have a lot of those, or a handful of those, or can you give people examples of some of that you pre-scripted in there?
Yeah, we do. We created a bunch of pre-scripted, like TPA TPA required, or patients CT negative. Like, so people don't literally have to type those. But now with the audio feature, that's even has decreased the need for us to have a lot of pre-scripted tools. But the pre-scripted tools helped us a lot as we implemented the technology, because then, it didn't take people time to type in and make it a little clunky or inefficient. So that when we did our Virginia Mason methodology, we were able to come up, hear from the teams what would work and what was some of those pre-scripted tools, and that's how we came up with probably about a handful, like I would say about 8, 9.
Right. So let's talk about the messaging and actually communication between team members. Now, as far as you said that you adjusted when the pharmacy was notified, tell me, how that worked in your system. Was it a different alerting time, or is that just a different expectation and workflow?
So we initially, when we implemented, before Pulsera, pharmacists, for every stroke case, the pharmacist would come to the emergency department or wherever the patient was, be it in the CT scanner, but they would come. And a lot of times what we saw, they would be standing around and time was being wasted, and it was disrespectful to them as well with their time. And if the patient wasn't a TPA candidate, then, it was sort of waste. So with bringing in a technology like Pulsera, where they would be alerted and able to see the process, then they can see when, the neurohospitalist says it's a TPA candidate, and be able to come to the CT scanner wherever the patient was. But what we found as we implemented was, believe it or not, that actually, with the pharmacist not being there, caused a delay and added some time to our metrics that we were looking at in getting our patients TPA quickly. So that's the beauty of having a patient, a Pulsera guiding team, and discussing these things at our biweekly stroke meetings, because we were able to look at that and see, hey, we need our pharmacists here at all times. And when we brought that back into the process, it was amazing to see that it really impacted positively on our patient receiving TPA. So I think the message here is sometimes as you implement things, don't be afraid to change something back depending on what you're seeing, and it depends on each facility's flow.
Right. So now you obviously you're very familiar with updating the workflows and stuff like that, and working with our client services teams. Hopefully you've had an awesome experience, but tell us a little bit about that experience and how that works in the background as far as when you see a change in your workflow, what's your normal activity as far as communicating with Pulsera itself?
Well, I have to say that it has been, I call them my Pulsera family, because it's been a truly wonderful experience from the time I started and we brought them in and helped us. There was no time I would contact them and I would not get a response. They were very involved and immediately addressed any questions, concerns. The other thing is they had on-site visits, so if we needed them, they were always available to even do that. Now we have a Northwest representative, which is great. So he comes and checks in frequently and able to help address anything. Sometimes it might be, say we're bringing in and we need to talk to anesthesia team about something. Having that person here has helped tremendously. So like that example with the pharmacist, being able to contact, and we have our contact teams, and say, here, this is what's happening. I have never had the experience where it's something they couldn't help us with or didn't try to help us, but the communication is very open. I have continual conversations with them, and even our stroke data person, our STEMI person. So we are in continual communication with the team, and if we have an issue or we think there's something that needs to be resolved, it immediately happens. And we're both also helping each other, because we're able to say to the Pulsera team, have you ever tried this? Or maybe look at this. And it's helped, as Pulsera evolves as well.
Right. So now let's talk about data just a little bit more before we try to wrap up for questions. As far as, the data dashboard, tell me who owns this at your system as far as pulling data. You said that you do a biweekly review. Do you pull it in that PDF version? Or are you pulling the data as well in that comma-separated values version that we offer?
So we pull it from so we have a data person who pulls the Excel from Pulsera, and that information is exported in, and that's how we get our data. And just to be clear, we also we have vetted the data, so we also look back in our Cerner platform to make sure that that's what we're seeing. So we vet it, and it has been accurate. So that's the Excel we pull from the reports from Pulsera to get our data points.
Awesome. Yeah, one of the most impressive things when we first started using it in the system where I came from, it was really neat to see the export coming out of the system that actually already had pre-calculated fields. It had the discrete data fields, but also the pre-calculated ones in a usable, digestible format that you could share with your team as well. So we're going to wrap up and talk about team feedback. As far as the system, how are you using it to give feedback? From being a previous ER nurse, a lot of times we would care for these patients, and you being an ER director, you would have to hunt down the teams that took care of them afterwards to give that information. How has Pulsera helped you as far as having a better team engagement or feedback loop to them?
So, before we had Pulsera, we had done a lot of work with our EMS team to try to figure out just exactly what you said, Forrest. We heard so much from our EMS partners because we do a lot of work with them, and we're always meeting and getting feedback. And one of the things is, I wish I knew what happened to that patient when I brought them in. And we had created, so we would literally have to take time and put together all this information and then push it out to the EMS leadership team so they can push it out to all their teams or the teams involved. But now with Pulsera, it's so easy because it's so quick to get the data and send it back to our EMS agencies. And this is one of the great features of having our EMS teams on board, because we don't have to use that time anymore, because they will have access and they can see the patient flow through their time in the hospital. So I think Pulsera is going to be great for having us not have to spend time to do this rework, but being able to communicate in real time and also clear data, and the teams, EMS teams, getting what they wanted.
Right. Yeah, I think that's one of the nice things about it, because you really, when you close the case out, everybody that was involved in it gets a push notification, and then they can go back and look at the information themselves without having to take that quality nurse or quality staff to do those feedback forms that might not always get back to the entire team that care for them. So we're going to do one more thing before taking questions, and we're going to talk about your experience with how you interact with your spoke facilities and how Pulsera has helped with that, or how you see it's going to help as you develop out this regional system of care.
So one of the biggest things with as a region, and I feel so proud to be part of the Virginia Mason system for this reason, because we took the chance to use this product even without our EMS teams using it. But we did it because we knew it was the right thing for the patients. And I am so pleased to say that being able to have this data to bring to a regional forum, and and other EMS teams and facilities, hospitals, have being able to use the same, I would say apples to apples, using Pulsera, have this data, and everyone talking about their cases and looking at areas of opportunities as one, is also breaking down silos in a whole regional manner and truly doing the right thing for the patient and providing superb care. And I think it will move our region to an even higher level of performance with what we are doing for our patients. So I think, all the areas, EMS agencies, facilities, having this technology will be a huge win for the community and the people here.
Awesome. All right. Well, Mackenzie, we're going to turn it back over to you and see what kind of questions the audience has put into the system.
Great. Well, thank you, Forrest and Rea, for that fantastic presentation. We'll now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. And the first question is from an audience member who's asking, I'm wondering about change management. How do you get people engaged to do this?
So, Rea, I'll start with that. And so one of the things that, as when I was involved in the implementation of our system and the quality side of it and trying to make sure that it worked well, we really did have concerns about the entire team, being willing to do that. So one of the nice things that I've seen is that actually Brittany Means with our company, who's a VP of Client Services, she did a wonderful blog post where our client services, they do education quite often on this change management concept, where they look at all the factors that will make a project successful. And, Rea did mention that, she's had a wonderful experience with that team as far as adjusting things. And I think it's important for us to know that we don't just, sell you a product and then walk away from it, because that's going to not set you up for success. And that client services team, they're there to support you through years and years as far as your journey through that. I don't know if you have something to add to that or not, Rea.
Yeah, so I always say machine is as good as the man who uses it or the woman who uses it. And what I stressed at the beginning, I truly believe in our Virginia Mason production system methodology, where we really set, we call it Nimowashi here, but we literally set our teams up who are going to be involved in this process months before we even start the journey. So we really talk about it, we get feedback, we include all the stakeholders. One of the things that I did before we implemented is really going to an organization that had implemented this and finding out what they learned when they were doing this. And that helped a lot in how and what we looked at, and as we worked with the Pulsera team. When we were doing the implementation as well, having the Pulsera team here with us provided that extra guidance and helped answer questions that the teams had. I will be honest that it is definitely a change in transitioning how you do things, and there are, the first thing you would think is people would be it's challenging for change, but truly showing and connecting the dots with the team and showing how it will be beneficial to them is important. So showing them how they literally save time and being able to spend more time with the patients and having the outcomes was key to
Right.
the change management.
Yeah, I'll refer people if or the person that asked that question to go to the website. There's a blog section at pulsera.com, and this article that Brittany posted is great. But I think the graphic is self-explanatory when you look at it, because it looks at vision, incentives, resources, skills, and action plan, and with all 5 of those components, it's called the Noster's model. When you look at all 5 of those components when they're there, then you will have success, and it'll show you examples of when something's missing, what that would create as far as within your team. So we really try to focus on maintaining relationships to where we can, foster these and increase the efficiency of the use of Pulsera within your system. So are there other questions there, Mackenzie?
Yeah, thank you so much, Forrest. Another audience member wants to know, what other healthcare entities does Pulsera communicate with besides EMS and hospitals? Are there EMS to EMS handoffs, transfer cases, etc.?
So the answer is yes to some of that, and yet to come for others. So go back through that list again as far as the the EMS handoff, I do know that is one thing that is currently in development. We really know that that's a valuable thing that we need to be able to do, and so our development team is working on that. What was the
Great.
other
And then the
part of
other
the
one
question?
was transfer cases.
Oh, yeah, absolutely. Transfer cases are already there. We have a transfer and consult capability within the system. So as long as you have a relationship with the other facility and they are a Pulsera user, then you can transfer from one facility to the other through the application, which really streamlines that communication along with the ease and efficiency of the system. And you get to see which clinicians are on call around that at that other facility, so you know who you're talking to directly.
Perfect. Thanks for elaborating on that. The next question is, who enters the group staff and how do they know who is on the schedule for any given shift?
Rea, you want to take that one for you? What your experience is?
So we have so for our stroke team and our STEMI, we have so who enters the information. So the person who activates is really the for the patients coming through the ED is the ED charge nurse. And the teams so if I am a neurohospitalist and I'm on this weekend, or I have the ability to toggle on when I'm on call. So that's how we know, who is on. Now,
Right.
if for some reason, because this question comes up, somebody forgets to toggle on, we have escalation plans. So we're able to get hold of that person, or either, use the backup system, like if you have downtime. So we have processes. But I'll tell you, once people start using it, they are always, we didn't have that issue. And so if I'm an ED charge nurse and I activate, I literally can see on my panel all the people who have responded to the activation. And if there's someone who didn't, we're able to have a successive way of getting hold of them. So we have processes in place for, like, if someone does not respond.
Yeah, and the system also has a safeguard that there has to be someone for each team on call at all times. So it's not going to allow people to go off call without someone else being logged on. We do have a new added feature which allows you to schedule your next shift and you're going off call, so you don't have to literally wake up like on a Sunday morning to take yourself off at 7 a.m. That can already be pre-scheduled. And you can have an administrator go in the background on the website and force people on call as far as their schedule setting it. But like Rea was saying, it's always better to have the individual, much like they turned on their pager in the old days, turn it on or off. And it's just as simple as toggling themselves on or off call within our system. And that makes it easier for administrators to manage the system as well.
Okay, great. I think that's helpful for our audience to know, so thank you. Another audience member is asking, does this have the functionality to integrate with the hospital EMR for patient registration to speed up the door-to-doc time?
Yeah, absolutely. So especially for an EMS arrival, because we can take pictures and add those to the system, you can take pictures of an ID and insurance information and have those people pre-registered prior to the system. And it's as simple as giving those registration clerks or staff Pulsera, functionality either on an app on a phone or an iPad or some other mobile device, and then they will get the alert, know they need to enter the patient into the system and then move forward. And a lot of times people will do what's called pre-arrival, but once they see eyes on the patient, they'll print labels and armbands at that point. Is that how you're doing stuff?
Yeah, and Forrest, I just want to add, that's how we do it here, even without having EMS on Pulsera yet. Once we get the call, we're able to pre-reg, and a lot of times, and just have the patient in the system. So once they hit the door, it definitely closes the gap with door to doc.
Awesome.
Wonderful. Well, we have another question here from an audience member who wants to know, who is responsible for making the different phases as complete in the patient's journey, i.e. door, doc, CT, groin puncture, etc.? And excuse me, that's for marking the different phrases.
So, Forrest, I could take that one.
Okay.
So it depends on, as you implement this in your flow here at Virginia Mason, what we have done is once the activation occurs, we really have our neuro hospitalists drive that piece with activating and closing out. And then if the patient goes, and I'm talking the stroke patient goes to the IR suite, that's the team that completes that part of it when it's completed there. So we have clear roles and responsibilities. We created what we call no and goes for each of the teams involved. So they're clear on who activates and who closes. We do have, that's how we get those parts completed.
Awesome.
Great. Thank you so much, Rea. Oh, sorry. Go ahead, Forrest.
No, you go ahead. I was just saying that's good response.
Perfect. Well, we have another question here, which is, was there any pushback from staff to using personal cell phones? And if so, how is that managed?
What a great question. As far as I'll take that one. So that was clearly, initially there were some teams who gave pushback, but what we did was we got some extra iPhones and we were able to supply it to those team members who didn't feel comfortable using their phone. But what we found is that those said team members, after a couple of weeks, decided to use their own phones because they didn't want to be walking around with two phones. So it pretty much helps eliminate that issue. But we do have extra iPhones in case someone would like to use it.
Yeah, that was our experience too when we deployed here in my area. One of the things that we also with the fire department EMS crews, we provided them with iPads for that use. But what we found is the majority of them then started gravitating to using their personal devices for the Pulsera alert because they were using the other one for their EMR. Even though it's easy to toggle between the two apps, they just said they would prefer to use their own device. And the nice thing about Pulsera, because it is a cloud-based system, it doesn't put any of those images or patient data directly on the camera roll or any of those things within the phone. It's much like a bank app. So it's HIPAA compliant because everything's based on the Amazon Health Cloud.
Wonderful. And it looks like we have time for one more question. And the question is EMS still calling with a report or just using the app?
So, Rea, I'll take this one since, we see a lot of EMS agencies. Basically, when you first start the process with Pulsera, for a few days, they do have a dual process. But with the app, there's a way to do an audio clip, and most of our systems will quickly transition to only having that audio clip be part of their communication. And then they stop the radio reports at that point. So they add an audio clip, or they can call directly through the system. You can also video conference as well between providers.
Great. Well, that is all the time that we have left for today. I want to thank Forrest and Rea for their excellent presentation and Pulsera for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Right. Have a great day.
You have a great day.